Bismillah. Assalamu alaikum wa rahmatullahi wa barakatuh. Today I'm with Dr. Ahmed, and there is this issue of COVID-19 in Kenya. And many people believe the pandemic is hyped up stories. Can you please tell us what is the situation?
Well, thank you so much, Hussein. To me, as an epidemiologist who is also a frontline health worker in the country, I don't think I agree with that statement. COVID-19 pandemic is a reality. It's not something that we can say is a fallacy or a myth. Those who are holding such beliefs, to me, I will say is a misconception. COVID-19, actually, by other name, it's called coronavirus. Coronaviruses is a family of viruses that cause traditionally zoonotic infections. What I mean by zoonotic infections is a disease of animal that can also affect, infect human beings at some point. The first coronavirus pandemic was first noted in China. That was back in 2003, if I'm not wrong, and it has claimed quite a number of lives globally. I think close to almost 1,000 people have died in that pandemic. The one that followed was the MERS coronavirus pandemic, which occurred in Saudi Arabia. Actually, it affected the pilgrims who were there at that particular time. That was in 2013. In 2012. Similarly, there were a few deaths that were associated with it. The 2019 coronavirus, which was first detected in China, occurred among, a cluster of individuals who developed pneumonia. And these individuals were working in seafood and live market in China. So they presented with pneumonia. Most of them actually developed a severe form of the coronavirus, and they have succumbed to death. So basically, coronavirus is not something new per se. It's a disease that has been there. It's only that the strain that has caused the 2019 COVID-19 has never been there before. So it's only the difference is in the strain, but the virus has been there before and has caused pandemic.
Thank you. What you are saying is coronavirus, COVID-19, is a disease that exists. Does it exist in Kenya?
Well, yes, it exists in Kenya. I think if you follow the national television or other social medias, you've seen cases that are always announced by the Ministry of Health. So we have cases of coronavirus in Kenya, and the first case, if I'm not wrong, was detected on May 15th. In this country. May 13th, sorry, in this country.
Okay. Now, how it is transmitted? Is it something that one can avoid to get infected? Wash your hands, keep distance, stay at home. Does those precautions, do they work?
Well, you can only exercise precautions when actually, first of all, you know the mode of transmission of a disease. So that is actually the basics you first of all need to understand. And the mode of transmission for the COVID-19 disease is, they say, contact of respiratory droplets from an infected person, or inhalation of droplet nuclei from an infected, after a cough by an infected person. So these are some of the ways, first of all, somebody can be able to get the disease. So basically, based on those modes of transmission, then if you exercise standard precaution, what we call standard precaution in infection prevention control practices, then you can be able to contain the virus. So what we mean by standard precautions is simple hand washing hygiene, or hand hygiene. Hand washing is one thing that can be able to help you contain the virus, because the elements that you use, water and soap, actually has got an effect on the virus. So it really deactivates the virus, and even at higher concentration, it might even kill the virus. So hand washing is one important precaution you need to take if you want to avoid getting infected with the virus. The other one is exercising cough etiquette. Whenever you sneeze, you are required actually to use a bent elbow. You can sneeze on a bent elbow so that you don't release the droplet into the space, so that other people can can inhale and get infected. So it's advised you exercise cough etiquette by sneezing on your bent elbow, or a flexed elbow, what we call a flexed elbow, or you can even use a tissue that is disposable. So the essence, or the rationale is actually not to release the droplet into the air, so that people don't get infected from inhaling whatever you release into the space. Another thing is actually avoiding contact with persons you think who are infected, and even staying at home. Of course, when you stay at home, so you are minimizing interaction with people who might be infected with the virus.
Okay. This COVID-19, the symptoms are similar to cold and flu. And everyone knows, when cold and flu pandemic starts, it catches everyone. Is it safe to say that some people will not get COVID-19, will not be infected by COVID-19? Or is like the flu, everyone will at one time or the other get caught up with it?
Well, definitely, in any outbreak, you will find people getting infected and others not getting infected. So, and the reason why some people may not get infected is possibly the interaction is very low outside there, or their immunity is so strong enough to fence off, the virus from developing into a disease even after entry of the virus into the body. You can have the virus and you don't show any symptom, and you even become or you get resolution of the disease depending on the level of immunity that you have. So basically, chances of getting will depend on several factors, just like I've mentioned. The frequency of having exposures to that can predispose you to infections can be one factor that may determine whether you will get infected or not. So the higher you are exposed, the higher the chances that you are likely to get infected. Of course, the presentation of COVID-19 disease, or the clinical manifestation, is more or less similar to what we experience in flu. Although we have also noted cases where there are no symptoms at all, what we call asymptomatic cases. People are having the disease, the virus in their body or in their system, but they are not showing any symptom. So I agree with you. I agree to the fact that some people might get the disease and some may not. So depending on the factors I've just mentioned. So
Okay.
if you keep at bay, those factors that predisposes you to getting infection, then you are less likely to get the infection. But if you are exposed to those factors, then chances are that either you'll become asymptomatic or symptomatic.
You see, there are two arguments here.
Yes.
The first argument is the approach Tanzania government has taken, that no curfews, no measures, everyone just does what they want to do. That's one way. And the issue of flattening the curve is not there. The other approach is our government's approach, curfews, measures, and all that. Of the two measures, which one do you think, from the medical perspective, is more effective in dealing with this disease?
Well, that's a very interesting factual information that you have asked me. I will say it's always good to exercise, preventive measures, because you may never know, especially when a disease is new and it has not hit the world before, and it's actually, it has been encountered for the first time. It's always good to prevent, because you may never know the fatality rates that are associated with the disease. And the Tanzanian way, if I just make a comment about the Tanzanian way, to me, it may be acceptable and it may not be acceptable. It can be acceptable in one way, because to some extent, if you let the disease
Take its own course,
then you are likely to promote the development of what we call herd immunity in the people. Herd immunity is where almost 80% of the population gets infected with the disease. They recover from the disease, and they form a barrier between those who have not gotten the disease. So those who have not gotten the disease, well, the lesser population will get protection from as a result of the recovery of those who have been infected. So those who have been infected and gotten recovery of the disease will form barrier between those
who have not been infected.
So, and naturally the disease will just resolve by itself. So there's that approach that can happen if you just let the disease
take its
own course. Of course, so many people will get infected. Those who will die on the way will die, especially the ones who are having underlying conditions like immunosuppression or diabetes or hypertension, because we have been told the disease, fatality rate is higher in those populations compared to the general population. So if we take if we follow the Tanzanian approach, then we are likely to promote the development of herd immunity, although the disease now will unleash all its effect to the people. But the Kenyan way, although the duration for flattening the curve might take some while, because you are interrupting the disease from taking its natural course by promoting preventive measures in the population, there'll be minimal fatality cases, because people will be exercising caution, will be implementing standard precautions and all that. So generally the two approach, to me, can be able to give results at the end, though it can be so dangerous, especially when you don't know what is the fatality rate, especially in the case of Tanzania. If the fatality rate for this disease was very high, as we are seeing in other countries, in the world, then the death toll will have been very high. So that's why, from the public health perspective, it's always advised you exercise prevention rather than just letting the disease take its own course, especially when a lot of information about the disease is not yet known.
I want to ask you a very tricky question.
Yes.
There is big money involved in COVID-19. International donors, there is a lot of money. Does that money reflect in providing protective gear for the medical frontline staff?
Well, I think I can only speak of what I have seen for myself, because issues to do with supplies and ensuring its distribution to the healthcare workers who are the frontline, staff in this particular pandemic is a reserve of the authorities. So I wouldn't want to talk about it so much. But what I know is frontline health workers who are on a daily basis engaging suspected cases, who are also doing contact tracing, and who also engage in clinical management and even in laboratory investigations, have the necessary PPEs.
Okay, let's go.
Of course, we cannot say they are sufficient enough. Of course, PPEs can never be sufficient, but what I know is in many facilities that I've visited, and even in several instances where I participated in control activities, we have been provided with the PPEs.
Okay, the cases are concentrated in Nairobi and Mombasa, urban centers. But now there is a lot of evidence that it's going down to the rural areas and the counties. From the information you have, probably you have access to such kind of information, are the counties well prepared? Because I've seen some reports where, a county like Wajir has got 3 beds, ICU beds. There was a case where a medical specialist passed away in Wajir, and there was lack of oxygen.
Well,
are they well prepared?
Well, again, I will repeat again by saying I can only talk about what I know, because I am not to all the counties. I can only talk of what is happening in Nairobi most of the time, because this is where largely my work is. What I know is, as a ministry, the first time the case was reported in China and in many other parts of the world, as a ministry we started to prepare ourselves as a country, so that should the first case be established in the country, then our facilities in the country, whether at the national level or at the county level, are ready to pick a case and manage appropriately. So a lot of sensitization to health workers has been done at national level. So many county frontline health workers have been trained. And the relevant PPEs have also been made available through KEMSA. So to me, what I know is, I don't know the difference in the level of preparedness, but what I know is there's some preparedness in all the counties. Even in one of the presidential announcements before actually lifting the lockdown between, in the areas that have been affected, between the counties and the cities, the president has said and has emphasized that counties must prepare themselves by having adequate isolation facilities, adequate patient management facilities, and also they should also up their capacity in terms of COVID-19 detection at the county level. That's why we have a number of regional labs which have come up and have shown capacity to detect COVID-19 disease in various
Okay,
counties.
we are coming to the end of the program.
Yes.
Now, there is already we are experiencing, large numbers of people getting infected, according to the daily reports, ministerial reports. In your own estimate, how long do you think is going to take to flatten the curve?
Well, based on the statistics that has been reported to us, the numbers are still going up. And I can say from the start to date of this pandemic, it's like we are now we have now reached almost the peak of this pandemic in the country. And we might need about maybe 1 or 2 months for us to see the curve coming down to numbers that are a bit lower.
For those who are doubting the existence of this disease, what message do you have for them?
For those who are doubting the existence of this disease, I want to tell them that whatever information that is relayed to you by different government authorities, whether national or the county, about the disease is factual. So let us not underrate that the disease is not there or the disease has got minimal effects. Very many popular figures in the country have succumbed to the disease. That is something which is in the public domain. I'm sure if you have not had one of your loved ones who have succumbed to the disease, maybe you had a friend or a relative who has succumbed to the disease. So I will want everyone out there to be very cautious, exercise the recommended standard precautions for containing the spread of this virus. And let us, basically, the control of a disease is about behavioral. So once we take care of our behaviors by actually following the Ministry of Health guidelines and the precautions that have been released, I think we will be safer. So please let us not underrate the effect of the disease. The disease is real. We have been part of the team actually that has even been detecting through our government labs. So it's not fictitious. The virus is there. Let us make sure we don't catch the virus. And for those of us who are infected, please let us avoid interacting with our loved ones and even with the general population so that we minimize transmission of the disease. So if we all take heed of the precautions that have been given to us, I'm sure we'll defeat this particular pandemic. So please let us accept the disease is real. It's not something fictitious. It is something that is there. Very many people are currently in the hospitals. Actually, the ministry has even come up with a home-based care policy for persons who are infected with coronavirus, because most of the hospitals have been overwhelmed. That's why the government is now considering isolation,
home-based care, yeah.
Isolation at home, or what we call home-based care. So I will say, let us be vigilant wherever we are. Let us mind about others, and let us modify our behaviors this time around by making sure we stick to the standard precautions that have been provided to control the disease.
Thank you, Dr. Viewers, subscribe, turn on notification, and keep sanitizing. Thank you for being with us.